would say that here at St. Jude, we've really approached that through a governance structure for our data analytics. And so we built a very robust executive steering council. Below that, we have a data analytics council. And we do it twofold, top down and bottom up. So there are a lot of departments that have great data needs, and they're looking at solving different challenges within their department, sometimes financial, sometimes not. But when they have a need for analytics, if they're not able to pull a canned report for that, they work through a request with the analytics council. The analytics council gathers these requests across the organization and really look at prioritizing. And the council's made up of representatives from operations, finance, clinical areas, as well as research areas. And they're really trying to prioritize where is the organization going to get the biggest bang. If there are conflicts or competing needs, that request or those requests may come all the way up to the executive steering council. Whereas an organization, we look at either what the outcome of producing an extensive data set is, or what is the outcome of not producing it from a risk or downside possibility, and make decisions at that level. Sometimes we may even look at bringing additional resources in if it's strictly a human resource issue that we don't have enough to produce. We have also really worked to try to push out for departments who have analysts within their departments, the ability for them to access data, integrated data that's in our data lake, which includes clinical, financial, as well as other types of data. So they can build their own data sets and work independently after going through a competency and evaluation period to get access to that level of data.
Okay, thank you. Bob, do you want to answer next on this one?
Sure. I think, again, as you indicating, I think we've really been trying to drive a little bit of leader expectations and even, what we might call standard work in terms of, how we expect them to be looking at their data on a regular basis, analyzing their data, et cetera. I think a little bit of a changing of the culture to pull data and analyze current state and certainly make that a part of a decision making. I think that, again, over the last 3-4 years, I think we've really built a nice data mart, I think really has allowed that to happen. And then probably consistent with what Pat is saying, we have a model, we call it finance business partners. And so it's part of the finance team, but each operating area, each department has a finance business partner assigned to them. And those people actually have gone through, competency training and using the data mart and knowing how to pull and what the definitions are. And there's ongoing training that happens monthly on the use of that data mart, et cetera. And so really just helping to elevate expectations at the senior leadership level about the fact that we should not be making decisions in a vacuum of data and analytics to support those decisions that we make. Now, again, we know that there's objective data and there certainly are subjective items that come into those decisions and decision making, but certainly want to make sure that we're covering both areas to make sure that there's a full picture.